Change can be daunting, but with its commitment to stewardship, the emergency department at the Bonnyville Health Centre successfully changed its processes, improving patient care and safety. The system had been unchanged for decades, and the team recognized it needed a new and innovative system to better manage resources and more efficiently provide care. With a minimal budget, the team reorganized the department and overhauled the process for triaging, assessing, treating, and discharging patients. Department leaders, nursing staff, clerical staff, and physicians all worked together to create a communication hub that improved the flow of information. There have been challenges, but the new system creatively and more efficiently allocates resources, and the team has reached its goal of establishing a safe and sustainable emergency department. As a manager of 6 programs at St. Mary's Hospital in Camrose, Joanne Reinhardt exemplifies stewardship through her tireless work with patients and hospital staff. Joanne consistently demonstrates that even with limited resources available in a rural setting, no challenge is too large. She helped achieve full accreditation status for the hospital's groundbreaking advanced chemotherapy clinic, which included working with staff to amalgamate a mind-boggling number of policies and procedures. Joanne also ensures the hospital's psychiatric program meets the needs of its patients, even though it's not a designated psychiatric unit and has no permanent psychiatrist. Working with senior leadership, she makes sure staff and patients are safe and supported, and necessary nursing and security staff are on hand when needed.
Thanks to the stewardship of Melissa Crozier, a nurse practitioner, staff at Edmonton General spend less time dealing with pressure wounds, the facility is saving money, and most important, patients are more comfortable. Melissa took on the challenge of finding ways to reduce pressure wounds, a painful skin condition afflicting patients who remain in one position for an extended time. Her work led to eliminating the use of the soaker pad, which creates excessive moisture and pressure, major contributors to the condition. Melissa has been approved for a grant to develop and support an Edmonton General wound management program. She is educating frontline staff on ways to improve the care and comfort of residents, which will create even more good stewards in wound management.
Through its commitment to patient-centered care, the PreAdmission Clinic Advisory Committee at the Grey Nuns Hospital is demonstrating stewardship in healthcare transformation and innovation. The team saw a need for standardized processes to better serve patients visiting the PreAdmission Clinic before elective surgery. It developed new surgical screening guidelines, a toolkit that recognizes that not every pre-op patient needs every pre-op test and procedure. In its first year, the new guidelines have reduced system costs and improved the patient experience. For the surgeons and nursing team, they are saving time and improving confidence that the investigations and diagnostics ordered for pre-op patients coincide with best practice standards in care. The guidelines may soon be expanded across Covenant Health and the province. When the only CT scanner at the Misericordia Hospital needed to be replaced, the hospital faced 6 to 8 weeks without a scanner. Thanks to the stewardship demonstrated by CT and nuclear medicine technologists in Diagnostic Imaging, a plan was created to use existing resources. The plan included modifying the hospital's more basic SECT CT scanner in the nuclear medicine department so it could temporarily replace the main unit. Staff underwent training to use the replacement scanner, and CT and nuclear medicine technologists accommodated each other to share a small control space. Nearly every patient scheduled for a CT scan received it, saving the hospital money, ensuring timely diagnosis for patients, and avoiding what could have been frustrating experiences for everyone.
Change is never easy, but at St. Joseph's General Hospital in Vegreville, The Environmental Services team demonstrated a commitment to stewardship by not only accepting change, but embracing it. A review of the hospital's duty run and practices for EVS led to significant changes, including an FTE reduction. At the same time, the EVS team agreed to have an extra hour and 45 minutes added to its overall daily worked hours so it could provide extended housekeeping coverage. The team also took over waste management, a new approach at the hospital that was consistent with other facilities. The EVS team demonstrated its commitment to taking a responsible approach to using human resources. With the team's support, the changes are saving money, improving efficiency, and building sustainability for the organization. As a residential service aide at Uville Home, Leila Perez is committed to good stewardship, a commitment that's been valued by staff and residents for nearly 20 years. Leila consistently does more than she's asked to do and offers a helping hand to residents, their family, and staff. She often helps Porter residents back from evening programs when no volunteer is around to help. She ensures residents return to their units safely if she sees them wandering. And she always puts others first. A prime and unusual example is when she went into labor while at work and insisted on staying to make sure everything on the unit was tidy before leaving to have her baby, which arrived only 2 hours later.